Okay, this is Chapter 5 of the ATI Pharmacology, Adverse Effects, Interactions, and Contraindications. To ensure safe medication administration and prevent errors, the nurse must know why a medication is prescribed and its intended therapeutic effect. In addition, the nurse must be aware of potential side effects, adverse effects, interactions, contraindications, and precautions. Every medication has the potential to cause side and adverse effects. Side effects occur when the medication is given at a therapeutic dose. Discontinuation of the medication is usually not warranted. Adverse effects are undesired, inadvertent, and unexpected severe responses to the medication. Adverse effects can occur at both therapeutic and higher than therapeutic doses. Providers will discontinue the medication immediately. Adverse effects are reported to the FDA using the MedWatch program. Medications are chemicals that affect the body. When more than one medication is given, there is a potential for an interaction. In addition, medications can interact with foods, herbal medicines, or other unconventional remedies. Contraindications and precautions of specific medications refer to client conditions that make it unsafe or potentially harmful to administer these medications. Response to medications differ for individuals based on multiple factors, such as age, sex, disease process, and ethnic genetic variations. These factors can be responsible for many expected and unexpected adverse effects. Adverse medication effects. These effects can be classified according to body systems, so the central nervous system can result from central nervous system stimulation or excitement or CNS depression. Nursing actions. If CNS stimulation is expected, clients can be at risk for seizures and precautions should be taken. If CNS depression is likely, advise clients not to drive, operate heavy machinery, or participate in other activities that can be dangerous. Anticholinergic. Effects that are a result of muscarinic receptor blockade. Most are seen in eyes, smooth muscle, exocrine glands, and the heart. Client education. Manage these effects to minimize danger and discomfort. For example, dry mouth can be relieved by sipping on liquids. Photophobia can be managed by use of sunglasses, and urinary retention can be reduced by urinating before taking the medication. Avoid activities that could lead to overheating because there is a decreased ability to produce sweat to cool the body. Cardiovascular can involve blood vessels and the heart. Antihypertensives can cause orthostatic hypotension. Client education. Monitor for indications of postural hypotension, which is lightheadedness and dizziness. If these occur, sit or lie down. Postural hypotension can be minimized by getting up and changing positions slowly. Gastrointestinal, or GI, can result from local irritation of the GI tract. Stimulation of the vomiting center also results in adverse effects. Client education. NSAIDs can cause GI upset. Take these medications with food. Opioid analgesics slow peristalsis and can cause nausea and sedation. Perform methods to avoid constipation and GI irritation and promote safety. Hematologic. Relatively common and potentially life-threatening with some groups of medication. Nursing actions. Bone marrow depression and suppression is generally associated with anti-cancer medications and hemorrhagic disorders with anticoagulants and thrombolytics. Client education. Monitor for bleeding, bruising, discolored urine, stool, petechiae, bleeding gums. Notify the provider if these effects occur. Toxicity is an adverse medication effect that is considered severe and can be life-threatening. It can be caused by an excessive dose, but it can also occur at therapeutic dose levels. Nursing actions. Liver damage will occur with an acetaminophen overdose. There is a greater risk of liver damage with chronic alcohol use. The antidote, acetylcysteine, can be used to minimize liver damage. Hepatotoxicity. This can occur with many medications because most medications are metabolized in the liver. The liver is particularly vulnerable to drug-induced injury. Damage to liver cells can impair metabolism of many medications. causing medication accumulation in the body and producing adverse effects. Many medications can alter normal values of liver function tests with no obvious clinical indications of liver dysfunction. Nursing actions. When two or more medications that are hepatotoxic are combined, the risk for liver damage is increased. Liver function tests are indicated when clients start a medication known to be hepatotoxic and periodically thereafter. Monitor clients for manifestations of hepatotoxicity, like nausea, vomiting, jaundice, dark urine, abdominal discomfort, and anorexia. Advise clients to monitor for these manifestations. Nephrotoxicity can occur with a number of medications, but it is primarily the result of certain antimicrobial agents and NSAIDs. Damage to the kidneys can interfere with medication excretion, leading to medication accumulation and adverse effects. Nursing actions. Aminoglycosides can injure cells in the renal tubules of the kidneys. Monitor blood creatinine and BUN, as well as peak and trough medication levels for clients taking medication that is nephrotoxic, such as acyclovir, aminoglycosides, cyclosporins, NSAIDs, and amphotericin B. Hypersensitivity and allergies. Hypersensitivity and allergy are terms used interchangeably. Occurs when an individual develops an immune response to a medication. The individual has been previously exposed to the medication and has developed antibodies. Hypersensitivity or allergies can result in a mild reaction, like itching, rash, watery eyes, sneezing, rhinosinusitis, or severe reaction resulting in anaphylaxis. Rapid or immediate hypersensitivity, called atopic allergy, causes an overproduction of immune globulin E antibodies, resulting in acute inflammation, histamine release, and vasoactive amines release, which is basophils, eosinophils, and mast cells. Atopic allergies can result in hay fever, rhinosinusitis, and can become severe. Severe reaction can result in angioedema, anaphylaxis, or allergic asthma. This can occur by inhaling, ingesting, injection, or direct contact with an allergen. Mild allergies like rash, hives, and rhinosinusitis is often treated with diphenhydramine. Angioedema is a severe allergic reaction that affects deep tissue, blood vessels, skin, subcutaneous tissue, and mucous membranes. Generally, angioedema involves the lips, face, oropharyngeal cavity, and neck, but also affect the intestinal system and other parts of the body. NSAIDs and angiotensin-converting enzyme inhibitors, like ACE inhibitors, are most common medications that can cause angioedema and can occur within 24 hours or any time thereafter. Nursing actions. Obtain a complete medical history to determine the type of medication the client is taking. Intervention is to apply oxygen, alleviate anxiety with reassurance, and if needed, maintain an open airway with intubation or tracheostomy if laryngeal edema, stridor, or inability to swallow develops. Treatment is with corticosteroids, diphenhydramine, and epinephrine, depending on the severity of the client's condition. Monitor for reoccurrence when medications wear off. Anaphylaxis and allergic asthma. Anaphylaxis is a life-threatening, immediate systemic reaction caused from an allergic response to a medication, dye, food, or insect bite or sting. Allergic asthma also has a rapid onset with similar causes. Manifestations of anaphylaxis can start with anxiety, weakness, generalized itching, and hives that progress to erythema and angioedema of the head and neck. Crackles, wheezing, decreased breath sounds, and feeling of a lump in the throat, hoarseness, and stridor can develop into a life-threatening condition that results in respiratory failure, hypoxemia, hypotension, tachycardia, and death. Allergic asthma has similar manifestations that involve the pulmonary system that can become life-threatening. Allergic asthma is the production of an asthma response following exposure to an allergen. Nursing actions. Prevention and rapid intervention are vital to avoid a fatal outcome. If the allergy is known, the client should wear a medical alert bracelet. The client should have available at all times injectable epinephrine. Stop the medication immediately if that is an antigen and notify the rapid response team. Establish an airway to maintain ventilation and administer bronchodilators if needed. Treat with epi, IM, or IV to constrict blood vessels, improve cardiac contraction, and promote bronchodilation of the pulmonary system every 5 to 15 minutes as needed. Administer diphenhydramine and antihistamine to decrease manifestations of angioedema and urticaria. Continue to administer oxygen, obtain blood gas levels, plan for the client to receive inhaled beta-adrenergic agonist or bronchodilators such as albuterol and metoprolol every 2 to 4 hours. Extrapyramidal symptoms, or EPS. This is abnormal body movements that can include involuntary fine motor tremors, rigidity, uncontrolled restlessness, and acute dystonia, which is spastic movements and or muscle rigidity affecting the head, neck, eyes, face, tongue, back, and limbs. This can occur within a few hours or take months to develop. Nursing actions. EPS are most often associated with medications affecting the CNS, those used to treat mental health disorders. Most EPS can be treated with anticholinergic medications. Immunosuppression, decreased or absent immune response. Nursing actions. Immunosuppressant medications, such as glucocorticoids, can mask the usual manifestations of infection, like a fever. Monitor clients taking an immunosuppressant for delayed wound healing and subtle manifestations of infection, like a sore throat. Your client education, avoid contact with anyone who has a communicable disease. Interactions, drug-to-drug interactions, increased therapeutic effects, nursing actions. Some medications can be given together to potentiate their action and increase therapeutic effects. Client education. If with asthma, use albuterol, a beta-2 adrenergic agonist inhaler, 5 minutes prior to using triamcinolone actinide, a glucocorticoid inhaler, to increase the absorption of a triamcinolone actinide. Increased adverse effects, nursing actions. Clients can take 2 medications that have the same adverse effect. Taking these medications together increases the risk of potentiating these findings. Diazepam and hydrocodone, bitartrate 5 milligrams, acetaminophen 500 milligrams, both have CNS depressant effects. When these medications are used together, clients have an increased risk for CNS depression. Decreased therapeutic effects, nursing actions. One medication can increase the metabolism or block the effects of a second medication and therefore decrease the blood level and effectiveness of a second medication. For example, phenytoin increases hepatic medication metabolizing enzymes that affect warfarin and thereby decreases the blood level and the effect of warfarin. Decreased side and adverse effects, nursing actions. One medication can be given to counteract the side and adverse effects of another medication. Ondansetron hydrochloride, an antiemetic, can be administered to counteract the side effects of nausea and vomiting for clients receiving chemotherapy. Increased blood levels leading to toxicity, nursing actions. One medication can decrease the metabolism of a second medication and therefore increase the blood level of the second medication. This can lead to toxicity. Fluconazole inhibits hepatic medication metabolizing enzymes that affect ariprazole and thereby increases blood levels for this medication. Medication-food interactions. Food can alter medication absorption and or contain substances that react with certain medications. For example, consuming foods with tyramine while taking MAOIs can lead to hypertensive crisis. Clients taking MAOIs should be aware of foods containing tyramine, like cheese and processed meats, and avoid them. Vitamin K can decrease the therapeutic effects of warfarin and place clients at risk for developing blood clots. Clients taking warfarin should include a consistent amount of vitamin K in their diet. Tetracycline can interact with a chelating agent in milk and form an insoluble, inabsorbable compound. Instruct clients not to take tetracycline within 2 hours of consuming dairy products. Grapefruit juice seems to act by inhibiting medication metabolism in a small bowel, thus increasing the amount of medication available for absorption of certain oral medications. This increases either the therapeutic effects or the adverse reactions. Instruct clients to not drink grapefruit juice if they are taking such medication. Food often decreases the rate of medication absorption. However, some foods increase the rate of absorption of certain medications. Contraindications and precautions. A specific medication can be contraindicated for a client based on the client's condition. For example, penicillin and its derivatives are contraindicated for a client who has an allergy to penicillin. Precautions should be taken for a client who is more likely to have an adverse reaction than another client. Morphine depresses respiratory function, so it should be used with caution for clients who have asthma or impaired respiratory function. Pregnancy labeling. Implementation of newer FDA pregnancy labeling guidelines began in 2015. The pregnancy and lactation labeling rule mandates 3 sections for labeling: pregnancy, lactation, and females and males of reproduction potential. Before administering any medication to a client who is pregnant or could be pregnant, determine whether it is safe for use during pregnancy.